Hi friends, I welcome you again to my channel. Today we will be discussing on Hcai surveillance key definitions. As my friends, some of them, they requested me to make some video on Hcai surveillance. So we will be discussing on this Hcai surveillance today. So what is Hcai surveillance? Before that Hcai surveillance, we are going to discuss what is surveillance first. Surveillance क्या होता है? सर्वेलेंस क्या होता है? नॉर्मली सर्वेलेंस मीन्स इट्स नॉट लाइक सीसीटीवी सर्वेलेंस, यू सी द इमेजेस, इट्स नॉट लाइक दैट. सर्वेलेंस मीन्स इट्स ए ऑनगोइंग प्रोसेस ऑफ डाटा कलेक्शन and their interpretation or analysis and sharing with the stakeholders about the reports. That is surveillance. Okay, it's a continuous process. It's not like that it will be for some days, some months or some years. It's continuous activity, surveillance. Okay, so then we will be discussing on Hcai surveillance. Hcai surveillance, otherwise called as Hcai. Hcai. So Hcai surveillance क्या होता है? Hcai means hospital acquired infections. Now we are calling it as Hcai, means health care associated infections. Health care associated infection. Okay, so Hcai is a normally one vast topic. Little bit there will be some difficulty in understanding certain terms. Please try to understand. If some problem is there, you please comment in the comment box so that I will be trying to explain better in the next videos. So what is Hcai? When one patient is, definition of Hcai. Hcai. What is this? What is Hcai? When one patient is admitted to hospital with some problem, certain problem. Suppose patient had a fracture in ulna and patient admitted to the hospital and had surgery, and after surgery he is getting some infection. That is maybe Hcai. Okay, or patient admitted with some allergy condition or with some other chronic problem like respiratory problem or anything, and after coming to hospital he is or she is getting another infection or so that will be Hcai. So actually exactly what is Hcai? Suppose one patient admitted to your hospital. Okay, जो दिन एडमिशन हो गया उसको हम बोलते हैं डेट ऑफ एडमिशन. ओके, दैट इज डे 1. ओके, देन डे 2, डे 3, डे 4. ओके, सो पेशेंट ये 2 दिन में कोई इन्फेक्शन डेवलप कर रहा है. सपोज आज एडमिशन हुआ डे 1 में एंड इमीडिएटली कुछ इन्फेक्शन का साइन सिम्टम डेवलप कर रहा है या कुछ कल्चर ले लिया और कल्चर पॉजिटिव आ जाता है, तो ये Hcai नहीं होगा. ओके, ये 2 दिन के अंदर, तो उसको हम क्या बोलेंगे? POA. POA मीन्स प्रेजेंट ऑन एडमिशन. दिस 2 days पीरियड इज टर्म्ड एज POA, present on admission. And POA I will be clarifying later what is actually POA and in which condition there is no POA. Like this thing we will discuss. Okay, so generally for every almost we are following that this 2 days will be POA period. Okay, it's not 48 hours. 48 hours concept now wrong. 48 hours concept wrong. It's 2 calendar days. फर्स्ट जो दिन एडमिशन हो गया उसको डे 1 बोलते हैं एंड नेक्स्ट डे को बोलते हैं डे 2. डे 3 ऑनवर्ड्स, डे 3 ऑनवर्ड्स कोई भी इन्फेक्शन पेशेंट डेवलप कर रहा है उसको हम बोलेंगे Hcai और Hcai. ओके, समझ में आ गया? So you will be having some doubt that why this 48 hours is wrong and 2 calendar day is correct. Why? Why this is wrong and why this is actually this surveillance, we are doing surveillance to compare something, like our data can be compared with national data or global data. So to standardize this thing, WHO and CDC, they have framed certain definitions so that which surveillance we are doing or we are conducting, this can be compared with the national or global data, so that we can know actually what is the status of the country or world and where we are. That is why they made it 48 hours wrong and 2 calendar as right. Why? In India is a developing country. Now most of the hospitals, they are having HIMS, Hospital Information System, HIS. Okay. Normally वो तो उसको बोलते हैं भी HMIS, Hospital Management Information System. So there will be online admission, discharge, everything will be there. Okay. But if you go to some African countries, there will be very healthcare system is very poor. Okay. There only documentation with pen and paper. So it's very difficult to note the exact time of admission. Okay. That's why. Then how they can compare their data with us? Suppose just I am giving one example. Me from Odisha, okay, and someone from Andhra Pradesh. Odisha test and Andhra Pradesh test is different. Why? Because suppose I am preparing biryani, okay, and my friend from Andhra Pradesh also preparing biryani, okay. My biryani and his biryani will be different. Why? Because first of all things, my ingredient, मैं जो चीज़ ले रहा हूँ बिरयानी बनाने के लिए वो different है than this, because they may be like more spice, I will be adding less spice. They may be specifically choose some spices, whereas I will be choosing other spices. So if we are not taking same ingredients, same method of cooking and same duration, like these things, then our taste and their taste cannot be compared. Yes or no? So that's why globally we made it 2 calendar days. Calendar days. After 2 calendar days of admission, if a patient develops a new infection, that will be called as HCI or HCAI. You got my point now? So I will give one example now. We will discuss certain example. Mr. Ram admitted, date of admission is 2nd August 3 p.m. Okay. Patient after 4 days develops sign of UTI, and on day 5 patient's urine culture sent having E. coli with 10 to the power 5 CFU. Okay. So now according to UTI criteria, I will discussing what is UTI, what are the criteria. For now just listen. CFU count is more than 10 to the 5 and E. coli is a pathogenic organism. So pathogenic organism, E. coli and CFU more than 10 to the 5, and there is sign. Sign means there was fever 100.6 degree Fahrenheit. Okay. So that means the patient satisfies the criteria for UTI and it's on day 4. day 4 patient develops fever. So date of event DOE. What is DOE? We will also learn now. So date of event for this case is day 4. Okay. So what we will call it is it HI or POA? It's HI because it's after 2 calendar days of admission, day 3 onwards. Starting from day 3 onwards, if patient develops any new infection, then we will call it as HI or SCI. And within 2 calendar days, like day 1 and day 2, if any patient getting any other infections, that will be termed as POA. That means patient might have got it from outside, so it will not be counted as HI or it will not affect the data of the hospital, so that our data will not be compromised. Okay. Then HI normally कुछ भी हो सकता है, HI कुछ भी हो सकता है, लाइक कोई भी पेशेंट जब एडमिशन होता है, सपोज उसको कुछ डिवाइस एसोसिएटेड इन्फेक्शन हो रहा है या नॉन डिवाइस एसोसिएटेड इन्फेक्शन हो रहा है, लाइक पेशेंट एडमिटेड टू योर वार्ड. ओके, पेशेंट एडमिटेड टू मेडिसिन वार्ड. ओके, मेडिसिन वार्ड में एडमिशन हो गया है, पेशेंट को हम बेड नंबर 10 दे दिया, यहाँ बेड नंबर 11 है, यहाँ ये बेड नंबर 12 है. ओके, वी प्लेस्ड आवर न्यू पेशेंट ऑन दिस बेड. ओके, बट दिस पेशेंट वाज हैविंग वन इन्फेक्शन लाइक TB. पेशेंट को TB था एंड इसका जो बीच में जो डिस्टेंस है वो भी कम है एंड ये पेशेंट हैविंग सिम्टम, तो इसको हम क्या करना चाहिए था, आइसोलेशन वार्ड में रखना चाहिए था, नेगेटिव प्रेशर रूम में नहीं रखा है, इसको हम रखा है, दूसरा पेशेंट को उसका बगल में रख दिया है. तो अभी क्या हुआ, ये पेशेंट को इन्फेक्शन आया, ठीक है ना. अगर 2 दिन के बाद इसको भी कुछ इन्फेक्शन हो रहा है तो उसको हम बोलेंगे HAI. ओके, एंड दिस इज नॉट device associated infections. Mainly when we are talking about HI, we are just thinking of Klebsi, Klebsi, Bhap. Okay, but this is a pneumonia. Tuberculosis infection may be a pneumonia, which may be called as hospital acquired pneumonia, otherwise shortly called as HAP. Okay, so broadly HI classified into 2 types, DAI, that means device associated infection, and non-DI, non-device associated infections. I just given one example about hospital acquired pneumonia, or we can tell as a surgical site infection, SSI. Okay, so DAI normally DAI क्या होता है, device associated infections. Majorly there are a lot of infections, but we will be focusing on certain infections like CA, UTI, normally बोलते हैं काउटी और कोटी, then Klebsi, CLA, BSI, central line associated bloodstream infection, central line associated bloodstream infections, then VAE. Earlier we are calling it as VAV. Okay, now this VAV surveillance has been stopped and we are following VAE surveillance. VAE means ventilator associated events. Okay, so COTI means catheter. We are for treatment purpose, like for monitoring urine output, we are inserting a catheter, urinary catheter to the patient. or because of some obstruction, anything we are putting. But what is expected, this catheter, we are putting catheter and draining the urine. Okay, this catheter is meant for drainage of the urine or measurement of the urine, like that. But what happens, while you are inserting or while we are maintaining this thing, there is some gap, okay, because of lack of IPC. IPC means infection prevention control practices, IPC practices like bundle care. Lack of bundle care, patient will develop CA-UTI. Okay, this is one of the major DAI, and every hospital, healthcare facility must conduct this surveillance. Okay, so how to conduct the surveillance, I will be preparing a separate video about surveillance. Okay, then Klebsi. This is one of the most important healthcare burden on the patient, mostly those patients who are getting Klebsi. Moreover, the outcome is death. Okay, so Klebsi means central line associated bloodstream infection. Central line associated bloodstream infection. Okay, so what are the causes of Klebsi? Morely, about 60% of the Klebsi is because of improper insertion. While we are inserting a central line, okay, this skin preparation, dripping, everything has to be perfect, so that the patient will not develop Klebsi. And after insertion, while we are handling, while we are maintaining the central line, we have to be more cautious that certain practices are there, like we are calling it as Klebsi bundle or central line care bundle. So this bundle practices can reduce the Klebsi rate. Okay, so why we will be doing such surveillance? Why not we will be going for only central line care? Is we are human. Until unless we are not getting something, we will not be changed. Yes or no? Suppose we will be telling that I am best because I am giving my perfect care. We are giving perfect care. How we will know? That's why surveillance is required, so that this standard of practice will be continued, will be maintained during all the time. Okay, and infection control is like all or none. All or नॉन कॉन्सेप्ट. अगर आपको करना है तो सब कुछ करो, नहीं तो एक भी कुछ भी गैप मिस किया ना तो गया. A very few seconds is required to enter the microorganism into your body and will create infection. Okay, that's why ये हो गया Klebsi. एंड देन होता है VAE. VAE मीन्स जो पेशेंट्स मैकेनिकल वेंटिलेशन में जाता है वो पेशेंट को न्यूमोनिया होने का चांस होता है बाद में. तो एर्लियर वी आर टेलिंग इट एज भाव, वी आर कॉलिंग इट एज भाव. लाइक there we are requiring chest x findings, like it become worsened and the oxygen requirement of the patient is increased, like PO2 and PCO2, everything data we require. And now this because of the certain insurance problem, like NHS decided that this BHAP term will not be used, because insurance people are telling that that patient developed because of the poor care while a patient is on a ventilator. That's why patient is getting infection. So why the insurance company will pay for the BHAP or that infection. That's why they stopped और reimbursement उनका नहीं हो पाया. तो इसलिए NHS एंड CDC वो क्या किया, उनका जो कोर कमेटी वो क्या किया, ये जो भाप टर्म को चेंज किया और कर दिया VAE सर्वेलेंस, वेंटिलेटर एसोसिएटेड इवेंट्स। वेंटिलेटर में पेशेंट जाएगा तो कुछ ना कुछ इवेंट हो सकता है। तो अभी वो टर्म खत्म हो गया। तो नॉर्मली व्हाट इज भाप, व्हाट इज VAE, व्हाट इज कोटी, व्हाट इज क्लैप्सी, विल बी डिस्कसिंग। ओके, देन वन की टर्म POA आई टोल्ड ऑलरेडी, प्रेजेंट ऑन एडमिशन। अगर जो 2 दिन के अंदर कुछ भी चीज़ हो रहा है तो उसको हम बोलेंगे, मतलब कोई इन्फेक्शन हो रहा है तो उसको बोलेंगे POA, एंड डे 3 ऑनवर्ड्स कुछ इन्फेक्शन हो रहा है तो उसको हम बोलेंगे HAI। ओके, देन अनदर थिंग इज IWP, दिस इज वेरी इंपॉर्टेंट, इन्फेक्शन विंडो पीरियड। इन्फेक्शन विंडो पीरियड क्या होता है? अकॉर्डिंग टू CDC डेफिनेशन, सपोज जो दिन आप कोई पॉजिटिव डायग्नोस्टिक टेस्ट किया, पॉजिटिव डायग्नोस्टिक टेस्ट हुआ, वो दिन से 3 days बिफोर and 3 days after, this 7 days time frame is called as IWP, infection window period. That means for that site specific infection like UTI or BSI, anything, that all the elements, all the criteria for that site specific infection should be met within this window period. Okay, for example, we are now going to discuss about UTI. In this example, you can learn what is IWP. Please stay tuned. UTI means urinary tract infection. UTI के लिए हमारा कुछ क्राइटेरिया होता है। तो फर्स्ट क्राइटेरिया क्या होता है कि पॉजिटिव यूरिन कल्चर with pathogenic organism मीन्स जो ऑर्गेनिज्म आ रहा है यूरिन में वो पैथोजेनिक होना चाहिए, कॉमेंसल नहीं। कॉमेंसल पता है ना आपको? सपोज स्टाफिलोकोकस एपिडेमिडिस, ये कॉमेंसल है, वो यूटीआई नहीं करेगा। सपोज ई कोलाई आ रहा है, ओके, एंड ये जो ऑर्गेनिज्म क्राइटेरिया में और रहेगा कि शुड नॉट बी मोर देन 2। सो जो पैथोजेनिक ऑर्गेनिज्म है ये 1 और 2 होना चाहिए। अगर मोर देन 2 हो रहा है तो नहीं होगा, ओनली 1 या 2 ऑर्गेनिज्म आना चाहिए यूरिन में। ओके, प्लस CFU काउंट, कॉलोनी फॉर्मिंग यूनिट। CFU मीन्स कॉलोनी फॉर्मिंग यूनिट मस्ट बी मोर देन इक्वल टू 10 to the power 5 पर ml। ओके, आपको सपोज यूरिन में जो कल्चर पॉजिटिव आ रहा है, रिपोर्ट देखेंगे तो ऑर्गेनिज्म का नाम लिखा होगा, उसके साइड में लिखा होगा द CFU, वो 10 to the power 4 या 10 to the power 3 या 10 to the power 5 या मोर देन 10 to the power 5 लिखा है तो वो यूटीआई के लिए सेटिस्फाई करेगा। ओके, देन प्लस शुड बी हैविंग एटलीस्ट एनी वन सिम्टम, एटलीस्ट any one symptom. So what are the symptoms? Symptoms फर्स्ट होता है फीवर, कोस्टोवर्टेब्रल टेंडरनेस, अर्जेंसी, फ्रीक्वेंसी। ये जो सिम्टम्स है इसमें से अगर कोई भी एक हो रहा है, एटलीस्ट जो कल्चर क्राइटेरिया देखा प्लस एक सिम्टम क्राइटेरिया देखा, इसमें से कुछ भी मतलब लाइक वो कल्चर पॉजिटिव, सपोज ई कोलाई more than 10 to the power 5 CFU plus patient had fever 100.8 degree Fahrenheit. Fever means it should be more than equal to 10 to the power 10 point. Fever means 100.4 और more. ओके 100.4 से कम होगा तो 100.4 डिग्री फ़ारेनहाइट से कम होगा तो वो फीवर नहीं माना जाएगा फॉर दिस यूटी सर्वेलेंस. एंड मैं अभी भी जो भी बोल रहा हूँ आपको, दिस इज फॉर द सर्वेलेंस पर्पज, दिस इज नॉट फॉर द ट्रीटमेंट पर्पज. ओके सो अभी क्या हुआ कि इसमें से कल्चर पॉजिटिव आ गया एंड टेम्परेचर भी था तो पेशेंट यूटी हुआ. ओके देन वी विल बी गोइंग टू द आवर प्रीवियस स्लाइड. ओके सो पेशेंट का जो कल्चर पॉजिटिव है, पॉजिटिव का जो डेट होता है वो हो गया अगस्त 5. ओके अगस्त 5 को कल्चर पॉजिटिव आया है एंड हमारा जो फीवर आया है 100.6 ऑन ये 6 7 ये 8 को फीवर आया है. ओके सो अभी हम क्या देखेंगे, हमारा जो IWP इन्फेक्शन विंडो पीरियड है ये 7 डेज का पीरियड होता है एंड ऑल द क्राइटेरिया शुड बी मेट विद इन दिस पीरियड. सो culture positive on 5th and there is temperature on 8th, so it's coming under this window period, so we can treat disease as UTI. ओके सो अगर आपको फीवर यहाँ नहीं था, आपको 9th को फीवर आया था 100.8. ओके सो वी कैनॉट टेल दैट दिस इज ए UTI because all the criteria for this UTI not coming under in this IWP infection window period, so that it will not be UTI. Okay, otherwise suppose let's take another other example. This is 4th, 3rd or this is 2nd. 2nd August patient had 100.9 degree Fahrenheit. Okay, so then what is DOE? We will tell what is DOE. DOE means date of event. Okay, which element will be made first for this site specific infection. Okay, and on which date, that will be called as DOE. DOE means date of event. So for this case you just see पेशेंट को बुखार पहले आ गया, फीवर पहले आ गया, ठीक है ना, एंड ये एक UTI कर रहा है तो हमारा जो डेट इवेंट क्या होगा 2 अगस्त होगा. ओके जो पहला आएगा कल्चर पॉजिटिव पहला आएगा तो सपोज यहाँ फीवर नहीं था पेशेंट को, कल्चर पॉजिटिव आया 5th को एंड 7th को 100.2 डिग्री फ़ारेनहाइट है. ओके this is also UTI and all the things happening under this infection window period, this 7 days period. So this is a UTI and the date event will be 5th, whichever will be earlier. अगर कल्चर पॉजिटिव पहले आ गया तो वो होगा HI DOE डेट ऑफ इवेंट. अगर फीवर पहले आ जाएगा तो वो भी होगा डेट ऑफ इवेंट. ओके यू गॉट माई पॉइंट. देन we'll be discussing on SBAP period. SBAP period क्या होता है, ये थोड़ा डिफिकल्ट है. ओके उससे पहले हमको पता होना चाहिए कि क्या होता है RIT. RIT means repeat infection time frame. Okay, where this is actually normally a 14 days time frame, 14 days time period, where day 1 is our DOE, date of event is our DOE. Suppose on August 1st patient develops one infection, then हम बोलेंगे कि वो जो एक कोई जो इन्फेक्शन हुआ उसका कुछ पीरियड होगा ना, लाइक हम बोलते हैं ना एक कोई भी इंक्यूबेशन पीरियड होता है, कितने दिन के लिए होता है, लाइक दैट कोई भी इन्फेक्शन के लिए एक RIT होता है या इवेंट टाइम फ्रेम होता है, उसको हम बोलते हैं रिपीट इन्फेक्शन टाइम फ्रेम. दैट मीन्स दैट साइट स्पेसिफिक इन्फेक्शन विल बी कंटिन्यूड फॉर दैट सर्टन टाइम, दैट इज ए 14 days period. 14 days period means suppose this is the DOE 1st August, then up to 14th August is this period को हम बोलेंगे RIT, repeat infection time frame. Okay, got my point? So क्या होता है, सपोज यहाँ आपको एक ऑर्गेनिज्म मिला था ई गोलाई, एंड ऑन 7th you are getting another organism Klebsi pneumoniae in urine, okay, and it's pathogenic also. So what you will call, whether you will take this infection as one infection and this infection as other infection? No. What we will do, we will be reporting as this is one UTI and organism, we will list organism. First one is E. coli, then second one will be Klebsi pneumoniae. Okay, just we will be adding the organism. Okay, we will not be adding one infection, we will not take another data event from here and it will spread it. It's not like that. Okay, so this is RIT, repeat infection time frame. Okay, then अभी बोला था आपको SBAB पीरियड. SBAB मीन्स सेकेंडरी BSI bloodstream infection attribution period. Okay, so what is SBAB period? SBAB period means IWP, infection window period plus RIT. ओके, इन्फेक्शन विंडो पीरियड जो 7 days का पीरियड होता है प्लस RIT, रिपीट इन्फेक्शन टाइम फ्रेम, एंड मोर एवर इट्स ए टाइम पीरियड. SBAB पीरियड मे बी फ्रॉम 14 days to 17 days. Okay, because depending upon the date of event that SBAB period will be counted. Okay, suppose where it will be 17 and where it will be 14, that depends upon that event. We will be discussing certain examples in our next video, so that you can learn what is SBAB period and what is RIT. Especially on this SBAB period only I will be making one video with some multiple examples, so that you can learn better. So up to that we are taking a break. We will be seeing you in the next video. So bye, thank you, and please never forget to like and subscribe my channel, and please support us and send your feedback, so that I can improve in my ability what I can do. Please, thank you.